Okay.
Yeah, today we're catching up with Peter. So Peter, as well as being CEO of Ardeo, which is a mature health tech company, is also a member of Crystalisr and is convening a very interesting pilot project, innovative pilot project called Care Concierge. Alf, I think you've got some questions ready for him. So
Yeah.
shall we do an quick interview?
Yes, thank you. So yeah, Peter, I was wondering if you could tell us a little bit about your story, how you got involved in Care Concierge and what inspired you to set it up.
Well, thanks for having me, first of all, and I'm glad to be on this event. So it started quite a long time ago, but really sort of came together over a period of time. And the root cause of the situation that we're in and the problem that we were facing was that we were looking after parents, family, neighbours on the same road as ourselves. I knew an awful lot of people, including medical directors, surgeons, social care workers, and they all seemed to have the same issues. When it came to that time when you were trying to look after other people, let alone yourself, it was incredibly difficult to navigate the health and social care services. And in addition to that, simply navigating your own care, for example, waiting for letters to be sent from the GP to the physio to the podiatrist to the imaging center if you had a problem with your foot. There were so many gaps in between the pathway and the relationships that we found that we were waiting for sometimes weeks or even months. And we have a very good background in healthcare tech in the secondary care market since 2003. And we've been designing solutions that help clinicians, administrative staff, support staff work together between hospitals. And we have about 50 or 60 hospitals now that use our system across the country. And essentially, when you walk into one hospital or a clinic, if they can't, if they don't have the necessary expertise or skills, our system allows them to syndicate that care across the country, and specialists can join in and help with second opinions. They can share resources and services between local hospitals and clinics, etc. And we decided that having looked after parents and as I say, neighbours that were close by, who were elderly, for example, and who weren't able to um, look after themselves and needed that help, we decided to put this together and create a solution which originally was called Health Vive, and that was a personal held app, a patient held app that allowed you to create a virtual medical team. And that virtual medical team could include a physio, a GP, somebody who's in the supply trade, for example, for modifying the bed or putting a stair lift in, all those things. And that was a virtual medical team or virtual care team that we were helping, we were developing the software for. That evolved over COVID and sort of, forgive the pun, crystallized to a point where we decided that we actually needed something like the Care Concierge. And the question is, what would Care Concierge do to help that situation? And the answer was that the Care Concierge desk essentially would be manned by human beings as opposed to a bot. And it would act as though it was somebody looking after your brother, your sister, your mother, your father. So the Care Concierge desk would actually help you in the way that you would have helped those people around you and in the neighborhood. So essentially, it's a help desk, and the idea is that the help desk, the Care Concierge, coordinates and does the administration between the GP, the physio, the hospital. It arranges the taxis for you. It makes sure that you've got the right paperwork before you leave and go for your consultation. It ensures that when a hospital sends a letter to the GP, that it gets there, but it also sends it to you as the person either looking after your neighbor or loved one. Or the patient themselves. But as part of that ecosystem, it's not just about the carer, health carer, or the social carer. There's also that community underneath there that provides assistance by way of, as I mentioned, the stair lift or modifying a chair, increasing a bed height, locksmiths, for example. And all these people essentially are there as part of the ecosystem to make sure that we're comfortable, or that our loved ones are comfortable, and make sure that everything works quite neatly together. So as part of the care concierge concept, we started to consider bringing together day centres, care homes, creating local communities of care workers that would go into the home or that would be in their offices, for example, their GPs or their surgeries. But we also decided to put together a framework and a network of local businesses and suppliers. And the idea is that the care concierge desk is a local hub and it should be repeated across the country. And they have background knowledge on the local bus stops, the taxi ranks, the how long it would take for a person to get from A to B, to the hospital, to the GP, or how long it would take for a locksmith to get to that person. And the idea was that if we were able to bring together a trusted network of suppliers in the healthcare industry, then they would be part of a self-supporting community. And I sort of started to nickname it. It's a bit like the neighborhood watch, where everybody looks out for each other. And I hate to say this, but we all have keys to each other's houses, and we make sure that if somebody's ill, we actually go and look after them on our road. And if we have skills, whether it's computing skills or other skills, we actually share that amongst our neighborhood. So if you look at the care concierge, it's a bit like that. It's a care neighborhood watch environment where we have trusted people around us, suppliers included, that can be called upon within the community and support that community. They clearly have a vested interest. If I'm a locksmith and I'm local and I've got an elderly parent who has to travel to a day centre or has had a fall and then I've got a broken hip, for example, it means that that locksmith also can trust that local community. But to get to that level, we as residents have to trust those people who are looking after us. And apart from all the usual criteria, making sure that these people have got, these tradesmen have passed certain security checks and tests, we would want them to be, if they're looking after my parents or if they're looking after my neighbour, we would want to know that they have a certain level of behaviour, their skills, the qualifications that they've got. So this sort of neatly wraps around. And looking at Crystalisr, I see this as a way of inviting and bringing through those suppliers and giving them effectively a kite mark. The Fit to Supply program that Crystalisr ran, for example, is quite important. We can repeat that. However, what we do this time is we make sure that they've got, obviously, the security checks and make sure that their background is good. We make sure that they're stable businesses, but we also do things like make sure that the way that they handle their security, big word, cyber essentials. So how do they make sure that their laptops are secure? How do they make sure that the data that they're going to be handling with our local residents is secure? Are they doing their accounts properly? Do they have the strength to make sure that they're going to be there today, but be there in 6 months' time? So there's all of that, which is the basics. But in addition to that, the what's in it for me factor is that if we've got a small business, if I've got a small business with 1 or 2 people working for me, or I'm a sole trader, and I bring somebody into this network within this neighborhood level care pathways, as we call them, I wouldn't want my customers or my prospective customers to be poached by somebody else. But we're going to accommodate that by saying, the people that will be working with you, even though you look at them competitively, in some cases, they're qualified to look after you, and we will make sure that your clients are retained. We'll make sure that there's a way of ensuring that there isn't any poaching going on. So there's lots of things to consider in this as part of the health economics of a local neighbourhood. It's probably worth saying that we're also trying to work collaboratively with the local Kingston College, for example. They've just launched a fantastic health hub. I think it's on the 5th floor, and they have a virtual ward set up for nurses to train and for care workers to be trained in. They have a setup which looks like a care home. They've got a bed there with a chair and a sofa, so they can emulate having people in there and looking after them. And the idea is that they're able to train these people on the 5th floor. And with David, we attended this event last week, which was fantastic, as I say. But we also started to speak to the representatives there about bringing this idea of care concierge and about bringing people in to be qualified to make sure that these people know how to look after a resident when they walk into their house, how to be sensitive to them, how to make sure that they don't upset them, and also work with care concierge to make sure that the next person in that chain is notified to make sure that they can look after that person next. So, that's it kind of in a nutshell. But the basic idea is that how we would want to look after our friends, neighbours and loved ones is what the care concierge desk will attempt to do by ensuring that the patient or the caregiver, the primary caregiver, is able to navigate the services and that they're fully informed about what's going on so that they can be in control and more control of their care pathway to ensure it, as we call it, is continuous care. And that, as I say, involves the local community in terms of tradesmen, in terms of those suppliers. Does that sort of help?
Yeah, that's great. Thank you, Peter. And I can really a close friend of mine, who's obviously a lot older, just recently came down with a serious stroke, and seeing how the primary caregiver, her husband, is struggling to navigate the whole care package, and it's nearly like a full-time job for him, and it's and really hard connecting all the dots, making sure all the different departments are kind of a bit more seamless. And so I can really see how care concierge package will could do a lot to bridge that gap, to make it easier. I'd like to welcome you, Ishtar. Nice that you could make it along. Yeah, so have you got any questions for Peter? We're just having a kind of open discussion, talking about care concierge and what it is, and yeah, things like that, basically. If you've got any questions you'd like to bring.
Me or David?
You.
Okay.
If there's anything you wanted clarifying.
First of all, I just wanted to say I think it's amazing the service and the resource that it offers, just from what you've described. It's something. I also have a company. It's a small business, a startup, and I'm still getting in place things like compliance. We're still pre-revenue, but we focus on training, care, and consulting for aging, brain health, and dementia care. So really focused on aging and older persons as well. But from a personal perspective, which is what got me into doing the work that I do with dementia and aging, and it's very focused on the Caribbean where I started. And so I'm building out now the services and business activities for here in South London, where I'm based now. But as I was saying, from a personal perspective, it is just so desperately needed. Like what Alfred, you were describing with your friend, it's the sense of feeling, and I'm experiencing it now, trying to coordinate care for my mother in Trinidad. It's, even though on the paper it looks as if she should be well resourced in terms of she has 4 daughters. Everybody's at their midlife point in terms of the busyness of work and their day-to-day lives. And so figuring out how to get connected, which resources, having a sense of who are the trusted providers, going through the trial and error of trying and then realizing it's a horrible fit, then figuring out who are the alternatives. I think just what you described, we do a lot of this in dementia care, as you probably know, the care pathways and really figuring out continuity of care. It's so crucial. So I guess in terms of my questions, so first of all, amazing. Would love to learn more and see how we can connect as well. But in terms of the questions that I have, I really am curious about what you found to be the greatest challenges so far in building out the business side of it.
We come from a secondary care environment. That's where we develop software, and that's where our software came from. And we simply mapped that to a local community and thought, well, why don't we do this? We've all had experience of this now, personal experience, and it's desperately needed. Unfortunately, the difficulty in rallying around the bigger organizations is where we come unstuck. We got very, very close to engaging with the hospital and with the local council, only to be disappointed by the hospital turning around and saying, let's get everybody on board and then come back to us. Thank you very much. We won't go first. And they wanted 2 or 3 councils involved. So they wanted Croydon, they wanted Kingston, they wanted Richmond, they wanted different councils on board. And the second one was that the council themselves believe that they've got this in hand and they are working on improving relationships with the residents. That was their boilerplate answer. So we turned that upside down. So that was definitely the downside of what we tried to do. We couldn't engage with organizations that are oil tankers and refuse to engage with smaller businesses on a local level. They look at this someone said to me, Peter, you're flying at 50,000 feet. You can't see what's going on the ground level. You need to get closer. Or you need to make your staff run faster to keep up with you. And I think the council workers and the hospitals, or the council, local authorities and the hospitals and the clinics, they work at this 50,000 feet level, where they have their own agenda, they have their own budgets, they have this direction that they're focused on. And in reality, although they say the right things, they're not actually engaged with local communities, unfortunately. They tick a box and say, we're now dealing with that charity, we're now dealing with that organization, but they don't actually get to the level where they're dealing with the people on the street. And that's where we are.
Yeah.
So we turn that on its head, and this was something that myself and David spoke about, and others have spoke about. But primarily I've been working with David about this. And what we've done is we've decided to turn it on its head, i.e. we're not going to go to the big organizations anymore. We are going to go to those people, ironically, that those large organizations subcontract to. So they don't do any of the work themselves. They actually subcontract it on us anyway. So in a way, we don't need their permission to do this. However, by engaging with those on the street, those that actually provide the care and try and muddle their way through, handing over to each other between the organizations, we're going to approach them. And that's initially through Crystalisr. That's what we've decided we're going to do. So what we're doing is we're forming this idea. We're creating the care quality guidelines and the criteria. We're going to be working with Kingston Voluntary Association, for example. The college as well is where we're going to be working with them as well. So, they're interested in putting together a course that may be something that works in the local community. We're approaching it that way, and it's very, very early days. But in fact, I've been working on this with my son. We worked on this in about 2015, 2016, with the first iteration of Health Vibe, the patient held app, to create your virtual care team. And then COVID happened, as I mentioned, and then we started to approach it in a different direction. So it's taken quite a long time, but the revelations have only really come through, David, in the last 2 or 3 weeks, hasn't it? I guess.
Yeah.
Wow.
Yeah. And we did talk about
I'm very optimistic, because I think we're in a good place. Normally, you have a bright idea, and then you think, "Oh, crikey! Now to build this out, we've got to find a tech team, and then we've got to find the investment to go and build a platform, and you have to do all of that." Whereas in this case, Peter's got so much experience already, delivering this kind of technology. What we really need now is to draw it all together and implement a pilot project, which will prove the system really.
And Peter, what kind of SMEs and freelancers do you think will really be attracted to being onboarded onto the Care Concierge platform?
I think you've got a number of healthcare workers, social and healthcare workers and prescribers that work freelance or on contract, temporary contracts for lots of healthcare organizations out there, and they should be interested almost immediately. They won't be working for a very large organization and waiting for, in quotes, the next paycheck, for example. They won't be pushed on a timetable to go from A to B. My wife's, we lost up my in-laws 2-3 years ago now, and one was dementia and one was old age. There were 3 sisters working on that, you know, keeping the admin going, basically, one in Germany. And that's what it took to organize this sort of care. But what I noticed, and it was terrible, was that the workers that were working for care organizations were on a time, they were on a slot. It was a bit like Uber drivers. They were going from A to B. They had a minute to get from A to B. They had a lot of pressure. If you bring that back to being local, then it means that all those healthcare workers can, in fact, look after their neighbours. They can look after. They'll be paid for it, but they can do it locally. So that would be my first guess. My second one would be making it more formal. You know, me being a taxi driver and getting a job to take somebody to the airport versus me looking after my neighbours locally as a taxi driver and taking them to the hospital or to the GP. You know, creating. So I think in terms of local workers, I think they will be very interested. They'll certainly have an awful lot more control of their own lives, but they'll also be able to grow a business organically from a local footprint. They're not going to be pushed from pillar to post. I'm near the Kingston Academy on Richmond Road. I wouldn't have to go to Esher. I wouldn't have to go to Tooting, for example. There are tens of thousands of people, you know, literally within on my doorstep. And I think that's the difference. So I think it gives people the power to invest in their own community. And you're not going to be robbing Peter to pay Paul, first of all. It's the same everywhere. Why travel between schools, you know, boroughs in school to get to another school when you can go to your local school? It's that sort of thing. Carbon footprint, all those things. In terms of fit to supply, I think you can either be a taxi driver that just answers a job, or you can be a taxi driver that's actually qualified and understands and is available to look after a neighbour or look after somebody 3 or 4 streets away, and they know that you're qualified to take care of them on the way to the hospital. You know, it's that level, I think, and those sort of people who can appeal to physios.
Like knowing the taxi drivers trained to get you out of bed and onto the wheelchair, for example, or
potentially. I'm not sure a taxi driver will be allowed into the house.
okay, how little I know about it all, but
they'd certainly make sure that your paperwork was ready, for example. They could also make sure that they, you know, things like that. They'd do the admin for you, perhaps, but probably wouldn't help you out. I don't think they'd help you out a bit unless they're qualified to do so, and that is not a bad idea. You know, they can attend the Kingston College, they can be taught, and if they're qualified to do it, let them.
And if they've got the big enough van to put a wheelchair in,
that's right.
Might be worth it.
That's right. So I think that sort of. I mean, does that answer? I can't remember who asked the question first. But Ishtar, you asked.
You've
the
got
question.
to go in a minute, Peter, haven't you? So I thought before you go,
absolutely.
because Ishtar is a member of our Crystalisr community already.
Fantastic.
Hello again, Ishtar. We met back in November at the Innovation Summit, I think.
Yeah, the big South London,
the big South London one, exactly. So as we have a subgroup set up for healthcare in the Crystalisr platform, and as you're moderating it, Peter, can you tell Ishtar what she's supposed to do to get in that communication channel so that you can stay in touch with each other?
I think, I don't know myself, David, so I think I'm going to speak to Alfred first. I
So,
was volunteered yesterday.
Building it all out still.
At 2 o'clock in the afternoon, I was volunteered, or 3 o'clock.
Alf, you can explain, can't you?
Yeah, I can. I've still got to get the logged in part of Crystalisr platform a little bit more ship shape, but so you are signed up onto the platform, is that right, Ishtar?
I am.
Yeah, I believe I am. Yeah.
Okay. Well, I'll send you an email then, or I'll get your contact details, and I'm happy to walk you through the platform and show you how you can get onto. I think I'm looking at for each of the working groups, so health and social care, we would have like a Discord channel, a bit like a Slack channel, basically, where people in the group who have the similar interests can just throw things onto the channel and have a little kind of like online community based around that topic, and then the health and social care. So it's kind of like a, a group of an advisory panel, or community advisory panel on health and social care. So we'll try and onboard as many people within, that ecosystem as possible. And
I think,
then
sorry to
this,
interrupt you, Alfred. I've got to shoot. But
yeah,
just to finish off, Ishtar, it would be great to meet up with you face to
It would
face.
be. Yes, I'd love
Um,
that. Yeah, I'll just drop in the chat quickly my email.
okay. I'm off the Richmond Road. I work with my wife, who's prompting me to get out of the house now.
That's good wives do.
She
all right.
But you can find each other through the members list
Yeah.
Yeah,
as well.
I'll work on that today and send you both a bit little video walkthrough on
And that's my mobile WhatsApp. So
Oh, fantastic. Lovely.
yeah.
What I'm going to do is I'm going to screenshot it because I can't seem to copy and
Yeah.
paste it. So that's the best way to do it. And I'll drop you a line after I've had my next meeting.
Okay, looking forward to that.
Excellent. It was a pleasure
Okay.
meeting you. Thanks, everyone. Catch you all later.
Cheers,
Bye.
Peter. See you later.
So yeah, the
Excellent.
some of the ideas behind the working group are that, we'll kind of develop and call people into the health and social care working group. So we have, people in the field that people can draw information on and help work out common concerns and common problems. And there are, sub projects which will be a little bit more involved, that people might need to be have to apply for, or that get pulled into a project where you really actually get through to, delivering some things that might be involved in some sort of work related, kind of more contract, something that's a bit more contractual, whereas the working
Okay.
is a lot looser, cross
Mhm.
departmental, the kind of, idea space where things can, where barriers between departments can be thinned out a little bit.
Mhm.
And then the projects is like the getting things done,
Okay.
kind of part of it, and they're there to mutually support each other in a sense. That's kind of
Mhm.
the idea, the first iteration, or second or third iteration along the way, and we'll keep on iterating and figuring it out as we go along.
Mm.
Yeah,
That was
that's,
great.
that's the idea. So you got any other questions or comments before we wrap up?
What are some of the more immediate events, virtual or otherwise, that are slated?
Well, we've got a monthly get together for the working groups, so we'll slowly start building that up. Um, um, then we'll start rolling out the Fit to Supply courses and cohorts. So
Super, yeah.
there'll be
I
groups.
desperately need that, I think.
Yeah.
Yeah,
Okay.
because I'm still pre-revenue, and I mean, my North Star is revenue and profitability as soon as we start. So I really want to understand, how do I become, fit to supply? What
Yeah.
does the business need? And all of the related types of things. Because I think even at the big South London event, David, they were talking about as well the meet the buyer types of events. But even just now, based on conversation with Peter, and it sounds as if there are ways to enter into that supply pathway that may not necessarily be at that huge level, but it could be more immediate, especially given the stage my business is at.
Yeah.
Well, this month in February, there are new procurement rules that come into effect, and they
Right.
make it more easier for lower value contracts to be pushed out to local small businesses. But they're still trying to find their feet, the commissioners. So it's worth, in the meantime, if you've got your eyes on a particular commissioning organization, be it a trust or part of the ICB or a local authority, whoever it is, they're inviting small businesses to get in touch with them now, to just start a conversation. Say, well, I'm here, and I understand and I accept that you're just trying to find your feet when it comes to working with local small businesses, and this is what I think I can offer. Can you tell me a bit more about what sort of needs you're trying to cover in the next few months and years? And they get into a conversation, then immediately you'll be the first person they'll go to. So, because people have got limited time, they're overwhelmed and they don't particularly know what they're doing when it comes to this transition. So they'll be just only grateful to hear from someone like you. And you can help them they can actually bounce some ideas off you as well, I would say. Then we'll try, from the point of view of the Crystalisr platform, we'll try to gather together our feedback on how this is all working, and then we can provide that advice and guidance a bit more centrally, and then just kind of move forward together in this case.
Yeah, and also I'll be keen to look into how we might get some of the local businesses that become members of Crystalisr to supply services like that will get people fit to supply, so that we can kind of potentially work as a kind of umbrella organization with the various local partners that we have to do the things like the payroll and the accounting and various different aspects that are needed within the Crystalisr umbrella, so that it's easy for freelancers, for instance, to become a member of Crystalisr and then have the fit to supply criteria kind of a lot fast tracked, essentially, under our umbrella. That's plenty of business development that needs to happen between now and then, but this is kind of the direction we're planning to, we're looking at, directions we're looking at.
And there's the health and social care is an industry cluster that is a big priority for South London, which is why they put on that the event that we went to, with a focus on health. I mean, the other one that they did the previous year was on the green economy, the transition to net zero. That's another priority. And then the third one is screen industries and media, so like film and television, gaming, that sort of thing. They're very interested in South London. Whether there's crossover between all of them, I think there is to some extent, because you got there's a college just up the road from me near Epsom called Nescott, the Northeast Surrey College of Technology, and they've just put in an Institute of Technology, an IoT, funded by the government and supported by people like Gatwick Airport, which is a major local employer. And I guess they would see their role as working across all industries, including health. Try to deliver transformation. So there's quite a lot going on. But as Peter said, would you actually go to some of these big players, and Peter has done, local authority, Kingston Hospital, and the ICB, they all kind of looking at each other to see who's going to leap first, and then there'll be a kind of fear of missing out, and then they'll all jump in. But nobody wants to take a risk.
It's the chicken and egg problem, isn't it?
It is, yeah, exactly right. But it doesn't, because we're in this amazing position that it actually has got the tech. It's not as if we've got to say to them, okay, now give us £100,000 to build it.
Yeah,
that's not what we're saying. We'd say we're ready to do it. We need to take the integrated care system concept and put it into neighborhoods. That's what hasn't been done yet. It's a kind of a bit stuck.
Where care is actually received and desired.
That's right, exactly right. But we can do that. We can do it without them, but it would be a lot better if they did come on board. So we can try to onboard primary care networks, for example, into this. That would be a bit easier, because there you're dealing with small businesses and people that are accessible. Peter's already spoken to Stay Well, which is the elderly care charity they operate in Kingston, but in some other boroughs as well, I think. This is the alternative to Age UK. So Stay Well opted out of being Age UK. But in Croydon and other boroughs, it might be Age UK. That's a local provider there.
Oh, okay. Okay.
But I mean, Stay Well have tried to address this problem themselves, of multiple requirements when it comes to care, and they do have, for example, a maintenance man with a van, who drives around fixing things. So, but they would sure like some of the heavy lifting to be taken off their shoulders, so it's not just them.
Mm-hmm.
Yeah.
Mm-hmm. Yeah. Yeah, the primary care networks are one of my key targets as well in terms of potential buyers, because one of the first offerings that we were developing now is a brain health navigator training program. So kind of like what Peter was describing in terms of that concierge service,
Yeah.
really for care continuity for people as they age, and specifically focused on brain health and Alzheimer's disease and related dementia.
Right.
And as you're probably well aware, the thing with aging is that these things don't happen in isolation. So you're dealing with that in addition to dealing with your cardiovascular issues or your diabetes or your blood pressure. And so it's figuring out how do these different sets of investigations and providers and services, how do they all speak to one another, or at least stay aware of what one another is doing? So, in the US, for example, and this is from an entity that I led a project for Jamaica in the Caribbean for an entity called the Davos Alzheimer's Collaborative. And they did a project on timely detection for cognitive impairment. And so we collected data from around 750 persons 60 and older in Jamaica, but really trying to figure out what is it that they're presenting with, doing a cognitive screener, and then really using that. It wasn't necessary to say that we're going to move from screening to diagnosis, but also just from screening to understanding what's the actual health profile. And because the primary care providers, the surgeries, from what I'm understanding so far, even with Croydon, because they're not, each are different. Some are training facilities, some are very tech driven, very tech heavy, and they're just more triaging the clients as they get in and out. They have different ways in which they approach managing and thinking about continuity of care. So you need continuity of care to be, yes, in the primary care system, but also outside, as Peter was describing, with the other services that are community-based. So yeah, I'm really keen to continue chatting with him, and then to learn about how I could get support from Crystalisr to even think through the business development and business activities and getting to supplier status and revenue and that.
Okay. I guess the ball's in our court, isn't it, Alf?
Yeah, that's great. Yeah, some of what Peter was mentioning reminds me a bit of the have you guys heard of Buurtzorg, a project in the Netherlands? It was a kind of a care, I'll pop the link in the chat, but yeah, it's kind of a revolutionary kind of teams-based way of working that they implemented. So rather than it being all done through a centralized kind of system where they were all had their schedule of different people to go and visit and everything, they split into smaller teams of like 7 to 14 people with a and they kind of like self-managed themselves, and allocated themselves to different people in the neighborhood. So they're able to provide a much more in-person care, a lot more kind of in-touch care, but also they made massive savings on the care provision, and just and it was way better as well. So so that might look into that case study and
Yeah, I'll
bring
definitely.
that in as well.
Yeah,
Yeah.
that's really helpful. And what Peter was saying yesterday in our meeting was that where you've got local authorities that are giving uh, patient service users and their primary carers personal budgets,
Mm.
so they're then empowered to
Yeah,
spend
yeah,
those budgets how they want.
yeah,
And that means they need to know what's around and how they get
yeah,
good value.
Yeah.
yep,
Why not give it to your neighbor as opposed to someone you've never
Well,
seen?
people would, they would say exactly right. If somebody's been helping them out and say, well, now I've got a personal budget, so I can cover your costs, and then some, sort of thing. And wow, isn't that empowering, rather than being told who's going to come into your house and clean you? Like,
yeah,
Because
yeah,
that's like the unpaid household economy, isn't it? In a lot of ways, this kind of a lot of the care that happens in society is unpaid work, and
it
it's
is,
yeah.
yeah, it
um,
is.
anyway.
I'm just putting in the chat there the company website, and one of the things I'm interested in talking with you all about more, as we develop, and definitely talking with Peter about, is the resource directory tab that I'm building out there. So right now it's Caribbean focused, and it's just a few splattering entries, but really what I'm envisioning for that is a marketplace. So very similar to what you were just saying, David, in terms of people needing to know. So if primary carers actually have a budget,
Yeah,
then they'd be able to see, what's available in my space. And if it could be geographically kind of pinpointed, so you can see what's really close to you. And then the providers, the supplier side, because with marketplaces, it's always the demand and the supply you have to be building out. You have to figure out which side of the marketplace you want to build out first.
right.
Then it's to get them all listed on it, and figure out what is it that we need to do to make being listed there something that they want, like have a premium option or something like that. So again, these are all potential revenue generating possibilities that I really would love to work with you all to develop further.
Yeah,
Amazing. Yeah.
yeah, gladly.
Well done, Nishtar. I'm
Thank
just
you.
reading through the site. Yeah, there's a lot.
Yeah.
Yeah, there's a lot to take on board.
Yeah.
Well, without ambitious people like you and Peter, yeah, we'd be a bit stuck, wouldn't we? So thank goodness for that.
Yeah.
Yeah. Well, and without the help from you all, I think we'd be stuck. So we wouldn't know what to do, where to turn. Yeah.
Well, it's all work in progress.
Definitely, definitely. So
Yeah.
I'll look out in terms of the signing up with the community. I'll go on the site and see if I am in fact registered, because I believe I registered after we had the exchange, David, on text message.
Yeah,
It's just if I'm
For the
in
event.
the relevant hub, yeah.
Okay. Yeah. Yeah. I think then there's a sign up to do, but I'm actually working on a new sign up kind of
Okay,
fluid. So I'll get once that's set up, I'll send you a message and
super,
yeah.
and
super.
I think in terms of the fit to supply content, I mean, we have a lot of content because we delivered the big integrate program in 2022-3,
Okay,
and it needs refreshing. But I think I would like to have a target group that is specifically healthcare, because that way it's so much more relevant.
yeah,
And I think in any case, the specifics do vary considerably from
Well,
some other industries.
in a way, it hangs off from the working group. So potentially each working group might have their own kind of specific areas of fit to supply that are
mm,
pertinent
That's right.
to
yeah,
that
that sector,
working group,
yeah,
if you know
like
what I mean,
health
to
and
that sector.
social.
Yeah.
Mhm.
Yeah. And the working groups are in any case set up to exchange knowledge about topics. But
Yeah.
in order for that not to get just lost,
Yeah,
we need to take the nuggets out of that conversation and put it into the fit to supply training. And that's what
mhm.
we aim to do periodically. So the
Okay.
course has become refreshed.
Yeah, and one of the fast kind of low-hanging fruit pieces of work that we can do is we've got a kind of a knowledge resource database, which so if we get that content onto there, the first run of it, we can make a AI assistant have access to that information. So you can just ask questions that are relevant, ask questions that you want to know to the content. And what we'll be working on in the future as well is, you can fill out your business profile, and then once that's done, you can have pre-made up prompts to ask the right questions with the right kind of context to give you the best answer possible, really.
Okay.
To fast track that. So that's kind of another development area that we're looking at.
Super.
All right. Well, yeah, lovely to meet you.
Lovely to meet you all too. Well, because I met David already in person.
That's right.
Yeah, and we'll keep the conversation going.
Looking forward. All right.
Thanks very much.
All right.
See you later, guys.
Bye.
Bye.